Controversy is brewing over the conflicting outcomes of some of the COVID-19 tests carried out in various labs across the country. This after Kiambu Town Member of Parliament Jude Njomo lodged a complaint with the Health Ministry and the Parliamentary Health Committee after tests carried out on his late mother's body, Margaret Njomo, returned different results. Lancet, which did the first test, reported that she was COVID positive. However, a repeat test done on the request of the family at the Nairobi Hospital and the National Influenza Center returned negative results. Questions now abound on whether many unsuspecting Kenyans may have been caught in the contradictions. Let's get more from our very own Chimtai Goin.
We did not give our late mom the dignity, the respect.
Despite the bottled-up emotion, one could feel the pain of a son seeking answers after they were forced to hurriedly bury their 82-year-old late mother, Margaret Njomo, after samples collected from her body allegedly tested positive for COVID-19. The late Margaret Njomo was late March admitted at the Aga Khan Hospital after developing breathing complications, with a COVID test being a prerequisite for admission. A test was done and returned negative results. On June 8th, she fell ill once again and was rushed to the Mata Hospital for emergency care. She was unfortunately pronounced dead on arrival.
Then on 11th, we received a call from Mata Hospital, who told us that after we left the body, they obtained a specimen which they took to Lancet laboratories, and they have received the results which showed that my mom was COVID positive.
They painfully adhered to the government directive and buried her, but not before requiring that samples be collected afresh and tested at the Nairobi Hospital.
A day later, we got the results from Nairobi Hospital, which showed that she was COVID negative.
The dissatisfied legislator lodged complaints at various government departments, including the Health Ministry. The National Influenza Center retested the samples tested by Lancet and Nairobi Hospital. Here the results left the family more confused, since both were negative. The spotlight was then cast on Mata Hospital. Did it follow up on the inconsistencies?
It's negligence on your side, CEO. After that incident, have you done any further inquiry as a facility? Or you are just satisfied it was negative, or it was positive or negative? It's okay, they buried, that's it.
We did not follow up.
Mata Hospital, however, insists its decision to take the samples were based on health protocols to ensure the safety of its health workers who had attended to the patient, and especially those who would later handle the body, since the hospital's mortuary was not COVID compliant.
How many other Kenyans have gotten wrong results because maybe a laboratory was careless? There are many other Kenyans who are voiceless. Let me become the voice of those Kenyans.
Lancet Laboratories Group Managing Director Dr. Ahmed Kalebe, while defending the facility, says the incident of disparities was not unique, since different labs used different techniques, and that the outcome of tests would vary based on the time the sample was collected and the virus shedding period, especially in the case of those confirmed positive posthumously.
You can have the same sample tested on 3 different machines and they give different results, some even giving negative. This is unfortunately the part of the science limitation. And what I'm saying is, we've actually discussed this as a ministry or as a country. What should be done with those samples that have a low viral load?
Controversy continues to surround the hurried and night burials conducted when the death is COVID-related or discovered posthumously. The Ministry of Health expected to shed light on the conflicting reports next week and also give the burial protocol for non-COVID-related deaths. Chimtai Goin, Citizen TV, Nairobi.